you want to just tell us a little bit about the Reaching Home program and what some of the organizations involved with the coalition?
Yeah, sure. Yeah, and I remember those early days of COVID, and one of the pledges we all made was let's keep it out of, let's keep the homeless population safe because they're the most vulnerable. They're moving around, and I remember, like in the early weeks, some of the some of the homeless folks who were coming to food programs we fund down in Duncan or up here in Nanaimo, they didn't even know what COVID was. And that baseline education, with the federal dollars was so key. And, and I just want to thank you, Paul, because holy cats, like the amount of work we did those early weeks just to figure out what do we have to do, how can we respond, what kind of level of federal support we could get, and making that case for us. So, I mean, all of us were working, day and night to figure out solutions and get ready. And one of those pushes was to get more federal funding from Reaching Home, and it was COVID related. And so, Reaching Home is an amazing program across the country. Not every community in Canada gets it, but we were able to make a case good 12, 13 years ago to get funding, federal funding to address homelessness. And it's without that funding and without that support, many of the programs that you see operating that help either do food, connect people to housing, identify where they can store their, get a haircut, get their medical supplies, all of that kind of stuff are supported through programs that are funded through Reaching Home. And so for every year, the coalition, I mean, we manage that and work with co-chairs, which are from two nonprofits in town, Salvation Army and the CMHA, Canadian Mental Health Association. They co-chair it. We work with them in the city. And in essence, we get federal funding, it comes into the coalition, and we go, what are we going to do? How are we going to support to get more people off the streets? And we also do research. And so one of the things we do every year is what we call the point in time count. And I'm going to make my pitch now. For the next time we do a point in time count, I'd love for people to volunteer to help us with that. We did our last point in time count in March. We were one of the last communities to do one. We have over 400 people who are absolutely homeless just in Nanaimo. I could give you those same stats because we did the point in time counts in the other communities that our United Way serves, but we've got over 400. Now that, if we hadn't been doing the work through the coalition, hadn't had the Reaching Home funding coming all these years, we would have ended up with probably 800 homeless on the street just over the last, say, 4 to 5 years. So I think what I can say is because we have federal dollars, probably up till about 4 years ago, we kept developing new programs. We were moving people into housing, helping them get into resources to deal with addictions. About 4 years ago, we got slammed a huge increase. So, we went from 200 homeless to over 400 homeless in 2 years. And a lot of that has to do with the increase in cost of housing. And obviously, opioid addictions is also as a piece of that. So, what we do through the coalition is manage those federal funds and work to find better solutions, and measure what works and doesn't work. And this year, because of the pandemic and COVID, what we were concerned about was we get a massive outbreak within the homeless population, and they're going to other services and shelters like the Unitarian shelter and that. And then we're infecting, so many others who are working with them. And so really it was a pledge, and we've been blessed because of the hard work and the funding that we've got to keep COVID out of the homeless population. And so a lot of stuff is just, how do we, a service where you're feeding the homeless, and now you've got to deal with all of the needs around COVID. It's just, a lot of it was scaling up. I remember one of the things we had to fund very quickly was hand sanitizer, and masks and all that kind of stuff. The hospitals were getting it through the healthcare, but on the street level, our nonprofits, it was the United Way and federal dollars that came in. So, it's really been a concerted effort with the city, your funding and the federal funding to get ready for COVID, educate the homeless population, and then start to tweak all the services so we can still support people but keep them healthy.